Good morning po ulit sa ating lahat. Thank you po for waking up this early para sa ating mga sessions. I hope this will pay off nga, sabi nga ni Doc Eugene. So, our last session would consist of food hygiene and epidemiology. And majority of the questions for this morning will revolve around food hygiene since medyo mabigat yung kanyang percentage doon sa TOS natin. And based on experience, noong time ng exam namin, maraming lumabas na questions regarding this. Tapos, puro situational sila. Meron din tayong computations, however, magiging simple lang sila and can be done kahit wala kayong calculator. Pero magdala pa rin kayo. And abide by the rules po kung anong mga nire-recommend ng ating PRC. Okay, so question number 1. So same as usual po, try to answer at home. Tapos try to see kung ilan po makukuha natin. So carcasses of hogs affected with localized tapeworm. Tapeworm cyst should be A, passed for consumption, B, retained, C, passed for refrigeration, or D, condemned. So carcasses of hogs affected with localized tapeworm should be passed for consumption, letter B, retained, C, passed for refrigeration, or D, condemned. Yeah. The answer po here is letter C. They should be passed for refrigeration. So during meat inspection or doon nga, during uh, inspection or during slaughter, we have two types of disposition or inspections. We have antemortem and postmortem disposition. So antemortem disposition, this occurs before the animal is slaughtered. Postmortem disposition, ito na kapag nakatay na sila. Usually, after postmortem, dito lang natin makikita yung ibang lesions natin, no? So for the situation mentioned earlier, localized lang yung nakita nating lesions niya. So if localized lang yung lesions, usually, ang ginagawa natin is to trim and pass the rest of the carcass. However, wala siya doon sa choices natin. So refrigeration ang gagawin natin. Answer is C. So refrigeration, that is done in an attempt to kill yung mga cyst pa na natitira natin. So other dispositions would be to pass the entire carcass, to retain the carcass and its parts. Yun, trim and pass the rest of the carcass, condemn the affected parts, condemn the entire carcass, or conditionally pass. Ayun. So question number 2. This is a process which utilizes successive heating for the purpose of killing of bacterial endospores. It is a process which utilizes successive heating for the purpose of killing bacterial endospores. A, pasteurization, B, tyndalization, C, fermentation, or D, listerization. Yeah. Answer po is letter B, tyndalization. This is also known as fractional sterilization or intermittent sterilization. So this simply involves steaming or boiling yung products natin for 100 degrees Celsius at around 20 to 45 minutes. Tapos gagawin natin siya for 3 successive days or 3 successive times. Okay, so question number 3. Which of the following tests in milk detects the presence of formaldehyde? So number 3, which of the following tests in milk detects the presence of formaldehyde? A, Henner test, B, Resorcinol test, C, hanging drop, or D, Babcock test? The answer po here is letter A, Henner test. So Henner test, yung kanyang principle would be addition of sulfuric acid into the milk. Tapos kapag nagkaroon tayo ng yellowish color layer doon sa top ng milk sample, meron tayong formaldehyde. What you see here doon sa slide natin is a modified Henner test. And tawag dito, these are dairy products, not necessarily milk yung ginagamit nila. So number 4, malachite green test, also known as Rodin's test, is a test for A, meat pH, B, bleeding efficiency, C, meat type differentiation, or D, the freshness of meat. I repeat, malachite green test, also known as the Rodin's test, is a test for A. Meat pH, B. Bleeding efficiency, C. Meat type differentiation, or D. Freshness of the meat. The answer po here is letter B. So the Redance test provides an estimation for the efficiency of bleeding, especially in emergency slaughtered animals. Yeah, so results po are the following pag sa Redance test. So the fluid is clear and meron tayong blue color, maganda yung bleeding niya. So it's normal. If it is cloudy, tas may green, bleeding is incomplete, light green usually makikita dito. However, if it is olive green or medyo dark na, hindi na maganda yung ano natin. Hindi maganda yung pag-bleed doon sa animal. So question number 5. Which of the following tests is used to differentiate cara beef from beef? Letter A, carotene test, B, alcohol test, C, amidol test, or D, coliform test. Answer po is letter A, carotene test. So carotene, we can observe this in carabaos po, no? Because in cattle, colorless lang yung ma-observe natin. For carabaos, we'll see pale yellow compounds. And makikita natin siya around sa benzene layer ng pag-test. Question number 6. Which of the following animal species has meat which consists of red color with brown tint and has a sweetish odor? So which of the following animal species has meat which consists of red coloration with brown tint and has a sweetish odor? Letter A, swine. Letter B, beef. Letter C, cattle. Or D, chicken. The answer po here is letter C because the question is asking kung anong animal species. Ayan. Pag tinanong lang kung anong klaseng karne or what type of meat, answer dito would be letter B, medyo iba. So this is a summary for the comparison of meat acquired from different animal species as well as yung common or yung name nila sa market. So we have beef, cara beef, pork, chiffon, and chevaline. Ayan po. So yung beef natin, sweetish yung magiging amoy niya, almost milk-like. Ayan siya. Try to distinguish na lang kung ano yung mga pinaka-differences nila. Do not focus on similarities when doing comparisons such as yung ano natin, such as ito. Hindi ko na-include dito yung meat from ducks and chickens. However, for chickens, color of meat would range from pink to white. Spot color and consistency niya, cream ang color ng kanyang fat if meron. Fiber, especially around sa larger areas, would be firm din. As smell, none. Walang identifiable odor yung chicken. For ducks, the color of meat would be reddish. Tapos fat color and consistency would be yellow. Yung fiber or muscle fibers nila would usually be larger or more firm as compared to the chickens, especially around the breast area. Smell for duck meat would be gamey. Yan. Sa goat pala, I'd like to add na yung strong smell nila is from the production of caproic acid. Hence yung name ng acid na yun. So, ano lang, notes lang po natin. Okay, so number 7. This is a preliminary test to determine if there is an addition of formaldehyde to milk, meat, and fish. This is a preliminary test to determine if there is an addition of formaldehyde to milk, meat, and fish. So, amidol test, Bode's test, indole test, or sulfite test. The answer po for this one is letter A, amidol test. So, this is indicated by a yellow color, positive result. Question number 8. Which of the following tests for milk detects the addition of rice wash? Which of the following tests for milk detects the addition of rice wash? A. Resorcinol test, B. Bode's test, C. Indole test, or D. Starch test. Answer po would be letter C. So a positive result for our for the question is indicated by blue color of iodine after reacting doon sa sample. Number 9. Which of the following should not be done to condemned animals? So which of the following should not be done to condemned animals or condemned carcasses? So condemned carcasses should be destroyed by incineration. Carcasses may be rendered based on their merits. Carcasses may be buried in the ground for but not less than 50 centimeters. Or the burying of carcasses should be supervised by a meat inspector. Answer here would be letter C. When burying our carcasses, minimum size na kailangan natin is 1 meter into the ground. So for condemned carcasses, usually the first choice or the first method of destruction would be incineration kasi it will destroy everything, pati bacterial endospores. Ayun. So by definition, excuse me, condemnation or destruction of condemned materials refers to changing it so that it cannot be used for food purposes na. However, there are certain conditions kung saan pwede natin siyang kung saan pwede nating i-process yung mga carcasses na condemned, especially kung meron tayong available na technologies. So ginagawa silang tankage or food for animals pa rin. So it depends kung anong kanilang merits, kung may possibilities. Ayun. So burying of these carcasses should be within the premises of the slaughterhouse, and it should be in the presence of two or more parties who will not dig it out and under pa rin sa supervision ng ating meat inspectors. So question number 10. These are single-celled living organisms, slightly bigger than bacteria that reproduce via body. Is it viruses, molds, yeast, or algae? There are only really two possible answers here. So we can cross out A and D. So single cell, the answer here is yeast. Molds natin, M is to M. Please remember na lang para hindi malito sa board exams later. Multicellular molds. So yeast, they grow at room temperature and they require less water than bacteria, but more than molds. So molds require the less number of or the less amount of water among the three of them. Number 11. Which of the following abattoir or slaughterhouse classifications allows the sale of slaughtered animals only within the city or municipality where the abattoir is located? Is it A, B, or C? The answer is letter B. Sorry. The answer is letter C. B classification. So AA or AA abattoirs or slaughterhouses, they have adequate technologies or adequate equipment, and the sale of meat from these slaughterhouses is eligible for sale in any market within the country, whether in for export. So this is the slaughterhouse with the highest standard. So A, this is eligible for sale only in any market within the country. They also have adequate technologies, although hindi na siya kasing taas ng AA. Letter B, eligible for sale only in the city or municipality where the plant is located. So they have almost less than adequate na equipment or facilities. Letter C, hindi siya pwedeng gamitin and must be closed until the bare minimum is achieved. Yeah. So question number 12. An animal will be condemned at antemortem if it is blank. If it is apparently healthy, if it is emergency slaughtered, if it is immature, or if it exhibits slud. So an animal will be condemned at antemortem if it is. The answer here is letter D, exhibits slud, because slud is a sign of toxicity. So for antemortem dispositions or judgments, we have the following: condemnation, suspect, reject, or pass. Condemn the animal or condemnation of the animal would happen if, first and foremost, if it is dead or if it is dying upon arrival into the processing plant. Ayun. We can also condemn the animal if it exhibits generalized edema. As long as generalized conditions ang pinapakita, automatic condemn yan, especially at antemortem. Meron tayong nakitang generalized bruising or generalized erythema, generalized mange. As long as generalized conditions sila, automatic condemn yung animal. Ayun. Animals showing septicemic disease, ganun din, generalized condition, automatic condemn na naman yan. Then animals showing signs of toxicity, yun yung clinical sign na pinakita natin earlier. Automatic condemned. Next, number 13. An animal is considered suspect at antemortem examination if it is exhibiting abnormal locomotion, if it exhibits localized edema, or emergency slaughtered animals, or D, all of the above. Ayan. So an animal is considered suspect at antemortem if it is letter D. So all of these are suspects. So what do we do kapag meron tayong suspect animals? They are separated for further examination, and depending on sa condition which is presented, we can try to treat the mentioned animals. So this includes downers or animals which has lameness. This may occur from a disease condition, or this may happen due to rough handling by our uh, plant workers. Localized edema. So this is also subject to further treatment. Or kapag reactor sila to screening test. So we have the following, ang Rose Bengal plate test, etc. Tapos ano sila for further examination or for further testing. If they tested positive using more specific methods, i-reject natin sila for slaughter, or worse, i-condemn natin. Ayun, exhibit signs of surgery. For example, yung mga boars na recently castrated. They exhibit signs of surgery, kina-condemn or sinosuspect natin sila, and dinidelay yung slaughter hanggang mabawasan or maalis yung vortex. Question number 14. Suspect animals may be passed for slaughter if the animal is treated with antibiotics, if it is a downer, if parts of the carcass may be salvaged for food, or if the animal shows recent signs of parturition. Yeah. So the answer here is animals may be passed for slaughter if letter C. Parts of the carcass may be salvaged for food. So animals that recently underwent treatment, i-delay natin sila in accordance sa withdrawal period nung gamot na ginamit natin. Along with downers, antayin natin mag-normalize yung paglalakad nila or until matreat natin yung condition. Reject if it is an advanced stage of pregnancy, kapag kakapanganak. Pag immature animals, especially kapag hindi naman natin gagamitin for, or kapag hindi siya satisfactory for certain products, or recently vaccinated animals. Usually, yung immature animals dito would be yung mga calves natin, kapag hindi pa ganun kaganda yung karne nila for slaughter. Number 15. What is the recommended stunning and sticking interval for pigs? So what is the recommended sticking or stunning and sticking interval for pigs? A, 30 seconds, B, 10 seconds, C, 15 seconds, or D, 1 minute. Yeah. The answer po here is letter C, 15 seconds. So what is the stunning and sticking interval? So this is the time or the delay which happens after application of our stunning method, then the start of the bleeding of animals. Usually bleeding on reels ang ginagawa natin. Ayun, so we stun the animals to prevent unnecessary stress sa kanila in accordance with the animal welfare laws here in the Philippines. Another purpose of that is to prevent degradation or pagbaba ng quality doon sa karne nila, because kapag nagkakaroon ng release ng lactic acid, usually nagkakaroon ng masyadong pagtigas or pag-firm ng meat, tapos nagkakaroon din ng discolorations. So listed here is the stunning and sticking interval for several animal species. Do take note na lang. And stunning methods usually ginagamit is penetrative captive bolt. Yung kuryente hindi siya masyadong ini-encourage, although ginagamit siya. Number 16, the factor having the most significant effect on bacterial growth rate is letter A, initial numbers, letter B, temperature, letter C, moisture, or letter D, gaseous environment. Ayan. So answer here is letter A, initial numbers. The choices presented affect the rate of bacterial growth, pero pinaka-significant talaga sa initial numbers. Ayun. If the initial numbers of the invading microorganisms or the invading bacteria is low, babagal din yung log phase natin. So once the bacterial growth curve reaches the logarithmic phase, the growth rates will no longer depend on the initial contamination. It will depend on the other factors na. Ayan. Number 17, to be passable, bacterial plate count on meat should not exceed A, 10,000 per gram, B, 50,000 per gram, C, 100,000, or D, 500,000. Yeah. Answer here is letter D. Should not exceed 500,000 per gram. So, yung bacterial plate count natin. Number 18. The following necessitates outright condemnation of the animal except, I'll repeat, the following necessitates outright condemnation of the animal except, letter A, animal shows multifocal areas of red and bluish blotches and vasculitis. Letter B, mucopurulent nasal discharges are present. Letter C, vesicles are present at the interdigital space, or letter D, all of the above. The answer here is letter D, walang exceptions. All of this necessitates the outright condemnation of the animal. And this is for the following reasons. If meron tayong nakitang red and bluish blotches, this may indicate systemic or vasculitis from erysipelas. Pwede siyang classical swine fever or African swine fever. In other cases, PDNS. Pwede rin niyang i-indicate yun. Mucopurulent nasal discharges are present. Pwede tayong magkaroon ng systemic bacterial infection or hemorrhagic septicemia. So it's better to just condemn the animal. Vesicles are present at the interdigital space, may be an indication of foot and mouth disease. This is a reportable disease, so automatic condemnation and report sa appropriate authorities. Number 19, in terms of keeping quality of the meat, which pH is the most desirable? So in terms of keeping quality of the meat, which pH is the most desirable? Letter A, 5.5, B, 6.5, C, 6, letter D, 10. Automatic cross out na si 10. This is too high. So answer po here is letter A, 5.5. So the normal normal pH for muscles of a reasonably fed animal is 5.2 to 5.8. So a pH reading above yung 6.5 na na-mention natin earlier would indicate a low keeping quality of meat. Tapos if it is around 6.1 within 24 hours, it is also an indication of unfavorable conditions. Pwedeng meron tayong autolysis, pwedeng magkaroon ng bacterial growth, etc. Number 20, which antibiotic residue can produce a plastic anemia? So which antibiotic residue can produce a plastic anemia? Letter A, penicillin. Letter B, chloramphenicol. Letter C, doxycycline. Or letter D, trimethoprim sulfa. Answer po is letter B, chloramphenicol. Yun. Letter A or penicillin natin, ito yung common reactions na ma-observe dito, anaphylaxis, anaphylactoid reactions. Chloramphenicol has since been banned in food-producing animals via the laws listed on the slide, number 60 and number 90, series of 1990. Ayan po. Doxycycline may also produce side effects kapag merong residues, namely, pinaka-common would be discoloration of the teeth, especially in young animals, or especially in young people. Number 21, which of the following pigments found in animal tissues would deem it unfit for human consumption? 21, which of the following pigments found in animal tissues would deem it unfit for human consumption? Letter A, xanthophylls. Letter B, lipofuscinosis. Letter C, carotene. Or D, none of the above. We can just cross out carotene since we have mentioned earlier this is normally seen in cara beef. So the answer here is letter D, none of the above. So xanthophylls, this may be seen in yellow fatted sheep. So sheep normally has white fat sa karne nila pag nakita natin. However, if their diet consists of grass which has large amounts of xanthophylls, magkakaroon ng yellow deposition doon sa fat nila. Yun lang, wala naman siyang i-cause na adverse conditions sa humans after consumption. Lipofuscinosis, or otherwise known as brown atrophy, this is seen in older animals, or this may be seen in animals with chronic wasting disease. Kapag matanda siya, or kapag matatanda yung hayop, especially sa mga baka, makikita natin to or yung brown atrophy doon sa heart muscles nila. Next, number 22. The following conditions would render an animal unfit for human consumption except. So the following conditions would render an animal unfit for human consumption except letter A, PSE or pale soft exudates, letter B, generalized edema, letter C, bruising, or letter D, imperfect bleeding. Yan. So we can cross out generalized edema and bruising since generalized conditions, sabi nga natin, automatic condemnation siya. So the answer here is letter A, pale soft exudate. So pale soft exudate, this may occur in pigs that have been subjected to severe or acute stress right before slaughter. So this may occur after PSS then, porcine stress syndrome. So this happens because the pH of the meat falls rapidly to 4.7 sa affected musculature. Tapos nagkakaroon tayo ng protein denaturation doon sa area. Kapag kinain siya or linuluto, wala naman siyang ikokos na disease condition. However, yung meat na makukuha natin will be drier than normal and mawawala yung flavor niya. Number 23, which of the following describes glazy bacon? Which of the following describes glazy bacon? So A, this is a pale greenish color found on the surfaces of imported carcasses. Letter B, these are caused by high pH of the muscle at slaughter. Letter C, this is a yellowish green pigmentation that may be found on the surface of the carcass or organs. Or D, these are light green patches and streaks in muscular tissue of cattle, sheep, pigs, and horses. Answer here is letter B. This is also known as dark cutting beef. Ayan. So this is a result of high pH. So if the pH of the meat is around 5 to 7 or 5.8 to 7, nagkakaroon tayo ng darker coloration. Number 24, it is the bluish-black pigmentation of lymph nodes of lungs, particularly the bronchials and the substance of the lungs. Letter A, anthracosis, B, bile staining, C, brine staining, or D, jaundice. Yeah. Answer here is letter A. So this results from carbon ingestion or inhalation, sorry, from inhalation of carbon. Although melanosis can also produce black pigments, this is usually congenital and hindi naman siya cause for concern. Balik tayo dun sa question along with the choices. So bile staining, ito yung nakita rin natin sa earlier question. So this is a yellowish green pigmentation that can be found on the surface of carcass or organs. Pag nakita natin to, the meat will still be fit for human consumption. Although kailangan lang siyang mas linisan. So you can say that it's conditional passing of meat. Then next we have brine staining. This is found on imported carcasses then, and makikita natin dito would be pale and greenish na coloration. So and the pigmentations is a product of leakage of calcium. Number 25, pasteurization that consists of heating at 135 degrees Celsius for 2 seconds. So this is pasteurization that consists of heating at 135 degrees Celsius for 2 seconds. Letter A, low temperature long time. Letter B, high temperature short time. Letter C, ultra high temperature, or D, none of the above. The answer po here is letter C, ultra high temperature. So ito po yung LT natin, low temperature long time. This is the classical pasteurization method. 60 degrees Celsius for 30 minutes. Then we have HTST, 72 degrees Celsius for 15 seconds. Then UHT, 135 degrees Celsius for at least 2 seconds. One of the main disadvantages of UHT pala would be leaving a cooked taste or smell doon sa gatas. So parang sunog. Yun naman ma-observe sa kanya. Pero this provides, I think, the longest shelf life among the three. Number 26, What type of spoilage is exhibited by cured meat? So number 26, what type of spoilage is exhibited by cured meat? Letter A, putrefaction. Letter B, slime production. C, odor plus slime production. Or letter D, fungal rot. Cured meat. Smoked and salted meat natin. So the answer here is letter B, slime production. Yeah, so fresh meat ang ma-observe natin mainly here would be putrefaction and souring. And this is caused by the following microorganisms. Yeah. Number 27, which of the following temperatures would kill mesophiles? Which of the following temperatures would kill mesophiles? Answer here is letter C. Mesophiles can survive at around 60 degrees Celsius. Pero higher than that, wala nang mabubuhay doon. Number 28, this is a toxin found in castor bean. Number 28, this is a toxin found in castor beans. Letter A, oxalic acid. Letter B, tetrodotoxin. Letter C, verotoxin. Or letter D, ricin. Answer here is letter D, ricin. So tetrodotoxin, this is usually found or seen in pufferfishes. Yeah, so ricin, this is obtained after extracting castor oil, and this is highly toxic, so it only needs a few milligrams to kill an African elephant. So automatically kapag taong naka-ingest nito, patay agad. Number 29, which of the following is the most appropriate utilization of fishes if it's somewhat soft and has a sour milk smell? Which of the following is the most appropriate utilization of fishes if it's somewhat soft and has a sour milk smell? Letter A, for sale sa market. Letter B, salting. C, condemnation. Or letter D, rendering. Ayan po. The answer here is letter B, salting. So, these are the visuals, odors, sensations na ma-observe natin for fishes na yung value nasa around 75% na lang. Hindi na siya nasa perfect or almost perfect condition. So, for perfect fishes, yung cornea nila would not be slightly sunken. They would bulge from the animal. So, for 75%, may discoloration ng makikita around sa gills. And yung skin is muddy, somewhat milky na. Odor, medyo maasim-asim. Pag hinawakan, medyo malambot na. Hindi na firm or hindi na mahirap alisin or nabawasan na yung difficulty sa pag-alis ng meat doon sa bone ng fish. Okay? So, what is a characteristic of fish that is around 100% value and is fit for market sale? Ito naman, what if nasa perfect condition yung isda natin? Alin ang ma-observe nating sign or ang ma-observe natin na sensation or touch, etc.? A, dark brown coloration with heavy slime around the gills. Letter B, sunken cornea, dull with milky white pupils. Letter C, reddening along the backbone. Or D, bulging or prominent transparent cornea with black pupils. Yan po. The answer is letter D, as mentioned earlier. If a fish is near perfect condition, dapat nagbabulge palabas yung mata. So if you touch a fish at around perfect condition, very firm and elastic. Di nyo siya matitear from the bone. Other values for fishes, this is around 25%, may lower pa. This is for condemnation na. So makikita natin is once you touch the fish, mas malambot na siya. Gritty to someone's touch. Tapos yung amoy medyo sirang gulay. Tapos they may smell like ammonia. So meron ng decomposition na nangyayari. Number 31, if the animal is held as a suspect and the condition is found to be impractical to undergo medication, the animal is A, further held as a suspect. Letter B, released for slaughter. Letter C, condemnation. Or D, whatever happens relies with the animal owner. So the animal owner will decide. Ano pong answer natin? The answer is letter C. the animal will be condemned. Number 32, which of the following tests aim for an immediate decision for acceptance or rejection of milk? Number 32, which of the following test aims for an immediate decision for acceptance or rejection of milk? A. Routine test. B. Platform test. Letter C. Organoleptic test. Or D. All of the above. Answer is letter B. Platform testing. So these are rapid quality sorting procedures, and they serve as basis for acceptance for rejection of milk or for pasteurization. So yung mention kanina yung routine test, these are performed naman to determine the keeping quality of the milk. So platform testing involves the following. We have organoleptic examination, flat on boiling, alcohol testing, acidity testing, and pH determination. So organoleptic examination simply involves the use of our senses, sense of sight and sense of smell. Ayun, flat on boiling, this assesses the suitability of milk for processing or marketing. And milk, especially kapag mataas yung quality niya, or maganda yung quality, they will not coagulate as easily. Pero if meron tayong presence ng bacterial number or bacterial populations, nagkakaroon tayo ng coagulation kaagad-agad. Similar din sa alcohol test and acidity testing, the presence of immediate coagulation would indicate that the milk is not acceptable. Number 33, which of the following accurately describes prevalence? Letter A, it is a proportion of the population affected by a disease at a given period of time. Letter B, the number of new cases that arise in a population over a specified period of time. Or letter C, the number of new cases divided by the initial population at risk. Or letter D, none of the above. Ayan, the answer is letter A. So this is the probability that an individual from a population already has the disease in any given point of time. So the prevalence can be computed by dividing the number of cases over the population at risk. So ang keyword dito is already acquired for prevalence in case na may malilito pa rin po sa incidence and prevalence rates. Number 34, which of the following accurately describes incidence? It is the proportion of a population affected by a disease at a given period of time. Letter B, the number of new cases that arise in a population over a specified period of time. Letter C, number of new cases divided by the initial population at risk. Or letter D, disease occurrence where or which is higher than expected. So answer po here is letter B. Pero punta po muna tayo sa choices. Letter D, this defines epidemics. So disease occurrence which is higher than expected. So letter B tayo, incidence. So incidence, this reflects risk, or kung keyword po ang magiging basis natin, kung sa prevalence natin is already acquired, for our incidence, the main words na hanapin natin would be chance to acquire or newly acquired, or basta makukuha pa lang. So this can be computed by dividing the number of new cases over the total population at risk. Number 35. So the following statements regarding incidence density is not true except letter A, it is interpreted as the rapidity with which new cases develop over a period of time. Letter B, interpreted as an individual's risk of contracting disease within the risk period. Letter C, all cases are counted on a single survey group. Or D, none of the above. Ayan. Answer is na letter A. 36 po tayo. Compute the case fatality or case fatality rate. A farm has 250 finishers. For an epidemic diarrhea, produce clinical disease in 50% of the population. So around 25 of the affected animals has died. Which of the following is the case fatality rate? May na po tayo. The answer here is letter A. So case fatality rate is the total number of deaths from a particular case or particular disease. Ayan. So computation dito, number of deaths divided by the number of animals acquiring the disease. So ang given natin kanina, 25 yung namatay and 50% acquired the disease. So from the total population, kukunin natin yung 50% which is 125. So it's very simple lang naman. So 25 divided by 125, that is 0.2 times 100, 20%. Yun na yung case fatality rate natin. Number 37, this is the number of deaths due to a disease that occur in the population during a particular period of time from a total number of animal time at risk of dying during the particular period of time. Is it A, mortality rate, letter B, case fatality rate, C, crude death rate, or D, morbidity rate? So we can just cross out letter D, morbidity, since this refers to disease acquisition, not necessarily death. And we can cross out case fatality rate. Since na-mention na natin, this simply refers to deaths na makukuha for a particular disease or a specific disease. The answer here is letter A, mortality rate. Because crude death rate, this includes deaths, lahat ng deaths within the area regardless of the cause. Number 38, this is the proportion of animals with the disease of interest who test positive. Excuse me. So this is the proportion of animals with the disease of interest who test positive. Letter A, false positive. Letter B, false negative. Letter C, sensitivity, or D, specificity. The answer here is letter C, sensitivity. This is also known as the true positive. Specificity, on the other hand, is also known as the true negative. Ayan. So the formula for sensitivity is here. Based na lang po tayo sa table and try to memorize this since they will probably ask this sa board exam. Mga given dito is animal populations. So animals who test positive for disease, who test positive for no diseases. Parang ganyan siya. Number 39, this refers to the ability of a test to produce consistent results. This refers to the ability of a test to produce consistent results. Letter A, accuracy. Letter B, precision. Letter C, validity, or D, reliability. Yan. Answer here is letter B. Accuracy simply refers to the ability of a test to detect the actual values kung kaya niyang i-test for positive or negative. So precision, this involves repeatability and reproducibility. So what does this mean? So ibig sabihin, pwede natin siyang i-test ulit within the same area to produce consistent results. That refers to the repeatability of the testing. Reproducibility, this refers to getting the same results outside doon sa initial facility. So kapag tinest mo ulit sa labas ng facility mo tapos same results yung nakuha mo, may reproducibility ka. So validity, on the other hand, yung isa sa choices natin, this has the ability to distinguish between who has the disease and who does not. Yun po. Then last, we have number 40. The ratio of the risk of disease in the exposed group to the risk of disease in the unexposed group. Letter A, risk ratio. Letter B, odds ratio. Letter C, attributable risk, or D, none of the above. Nandiyan na rin po yung keyword. So the answer here is letter A, risk ratio. Again. So risk is the probability that an individual will develop or die from a given disease or other health conditions. So from our risk, we can gather the following information: relative risk, odds ratio, and attributable risks. Ayan. So risk ratio or relative risk is computed by using a formula. Isasend ko na lang po yung handout later. So magsasite na rin ako ng examples. I'll try to make this as simple as possible. So this provides an estimate or provides an estimate on how many times unexposed individual are to experience a disease compared to non-exposed individuals. So if the risk ratio is more than 1, mataas yung risk for disease. However, if the risk ratio is less than 1 yung mako-compute natin, the factor means merong mas mababa tayong risk for disease. If it is equal, or kapag 1 yung nakuha natin, equal lang yung risk between exposed and unexposed populations. Ayan po. Thank you for listening. Thank you for participating po. That ends my session for today.